Hello and good morning to radiographic pathology discussion. So this will be a discussion of the triggers related to radiographic pathology. We have gastrointestinal system and then the hepatobiliary system. Okay, so the main discussion of the anatomy and physiology of your digestive system will be on your radiographic anatomy na subject. Okay, so this is just an overview. So this is the whole of the digestive tract along with its accessory organs. So, di ba, when we eat food, di ba, the food starts first with the oral cavity, that is your mouth. But when you eat food, dali mag-start ang food. And when you intake food by your teeth, your tongue, and then your salivary glands helps in the mechanical and chemical breakdown of the food that you are eating, di ba, in order for us to absorb those nutrients that we can take from the food that we are eating. And then food then will be swallowed. Then food will pass through the pharynx. And from the pharynx, mo flow dayon diri ang food towards the esophagus, and from the esophagus towards the stomach of the patient. Siya, the stomach of the patient, and then from the stomach of the patient, the food will then travel towards the small intestine. Okay, so the small intestine, these are the three main parts atong small intestine. First, we have the duodenum, the second is the jejunum, and then the terminal portion niya is the ileum. Okay, so this is the most proximal part, this is the middle part, and then this is the distal part of your small intestine or the terminal part. And then the small intestine is connected dayon towards the large intestine. So it's the ileum and then the cecum. Cecum is already part of your large intestine that connects. Okay, so from the ileum, food will pass through to the large intestine, passing the cecum. And then from the cecum, masaka din siya towards the ascending colon through peristaltic movement. And then from the ascending colon, food will pass through to the transverse colon, and then towards the descending colon, the sigmoid colon, the rectum, the anal canal, and then the anus. So this is your transverse, this is your descending, this is your sigmoid, kini mo letter S, and then you have your rectum, the repeating area, that is the storage for the fecal material, and then the anal canal, and then the exit towards the exterior, you have your anus. Then we also have the accessory organs nga nasa ato ang mouth. We have the parotid glands, and then we also have the submandibular glands, and then the sublingual nga gland. But these are the salivary glands nato, diba? These are pairs. We have two parotid glands nasa left and right, also submandibular gland, pair gihapon na sila, and also the sublingual gland, pair gihapon na sila. Okay, parotid gland nadadapit sa imuhang, diba, sa imuhang ramus, sa imuhang mandible, and then you have the submandibular nasa dapit sa imuhang gonion, and then you have the sublingual nga gland in which that is below or situated below your tongue. Okay, then we also have the liver, the largest solid organ in the body, and then diba, the liver produces bile, and then bile will be stored in the gallbladder for later on, diba, if ever makakauntag fats, the gallbladder will then contract and release bile towards the duodenum to help emulsification of the fatty materials nga ato nakaon. And then also to help with the digestive process, we also have the pancreas, which releases a lot of digestive nga mga juices in order for the food to be broken down chemically. Okay, and then we have an accessory na pod nga organ, the worm-like ni mga projection sa imong cecum, that is the appendix. Okay, so in radiology, the abdominal cavity is in the digestive tract. Most of its organs is located in the abdominal cavity. So that's why the abdomen ng mga x-ray is also important in demonstrating these structures. If ever mag-x-ray ta sa abdomen ni patient, so makita nato ang atong mga digestive tract that is filled with, most commonly filled with air. So if ever na ay blockage sa iyang small intestine, na blockage sa iyang duodenal nga part, so mapuno og hangin sa stomach, or if ever there's a blockage or problem in the large intestine, so we will see the large intestine that is filled with air in the radiograph. Okay, so again, if ever na ay we have this term, diba, radiopaque. Again, when we talk about radiopaque, that is white on the radiograph. And then pag radiolucent, sorry, pangit ang lagi. Radiolucent, that is black sa radiograph. So pag puno gani og hangin, radiolucent yung appearance sana, that means black. pag naay mga calcifications, okay, so radio opaque, that means so white. Okay, so we have the basic routine for an abdominal x-ray. We have AP projections. So that means same nga projection pero lain-lain ang position ni patient. So the first position nga i-take ni patient is the upright position. So the purpose for this is to demonstrate air fluid level. Okay, so that is the main purpose for an upright nato sa atong abdominal x-ray. So if ever na ay problem sa patient sa iyang intestinal tract, so we can demonstrate the air fluid level using the upright nga positioning of the patient. And then we also have the flat plate. So in the clinical setting, flat plate ang terminology nila, or also known as the recumbent position. That means ang isa is naka-upright si patient, nakatindog si patient, and then ang isa is naka-recumbent si patient or naka-lie down si patient, naka-supine si patient. We also have an acute abdominal series. For the function of this, actually almost the same lang sila except nga si acute abdominal series na lang siya addition of chest PA. Now for this, the acute abdominal series this is for the demonstration of pneumoperitoneum, the free air in the peritoneal cavity. Pneumoperitoneum. Okay, so later on in your clinical setting, in clinical practice or the internship program ninyo, in case you'll encounter this terminology, acute abdominal series, so it's not just the basic routine na AP projection with the patient upright and the patient in recumbent position, but you also have to take a third radiograph, just PA na radiograph. Okay, so again, that is for the demonstration of pneumoperitoneum. That is the air or free air in your peritoneal cavity. Okay, so we have here an example of an abdominal x-ray. So this is the letter R. That means this is the right side of the patient, this is the left side of the patient. Okay, so radiographic image, radiographic appearance of a normal abdomen demonstrating kidney shadows, the liver shadows, psoas muscles, transverse process of the lumbar spine. Okay, so again, diba, when you say radiopaque, that is white. Diba? Opaque ng mga materials. Radiopaque, that is white. So for example, you have your bony structures, you have your pelvis, you have your pelvis, you have your femur, the proximal ng mga femur, the femoral heads, you also have the coccyx here, you have the sacrum, and then you have the vertebral bodies, you have the ribs, but they appear white. They appear as radiopaque. Okay, that means they absorb a lot of X-ray. And then you have your intestinal organs, in which sila, diba, mga black nga portion. That means they are radiolucent. So if they are radiolucent, that means they are black on the radiograph. That means they contain air. Makabantay mo na ay mga parts sa atong radiograph which has black na mga appearance. So that means they contain air. So if this air would exit towards the anus, then that is your flatus. That's basically utot. Okay, so these are the black mga portions na to. Okay, so those are filled with air. And then this shadow here, na siya, that is the shadow of your psoas muscle. Then we also have the shadow of the left kidney. Again, this is the left side, this is the right side. We also have the shadow of the liver, pit nga portion. And then the right kidney is not well demonstrated. The shadow is not well demonstrated because of the superimposition of the gassy materials in your intestines. Okay, so there's a superimposition, that's why it cannot be demonstrated well. Okay, so the kidneys, diba, this is your psoas muscle. So kidneys are located lateral to the psoas muscle. Okay, so they are not superimposed but rather located on the lateral portion. Okay, so this is, as you can see, there are radiolucencies in this area. These are actually fatty layers of the patient. So that means the patient is massive in build. That means padulongay sa obese nga build, or hypersthenic. So, diba? Your fatty folds will be actually demonstrated on the radiograph. Okay, so we have here a left lateral decubitus. So this is the, but when you talk about left lateral decubitus, the decubitus terminology would refer to having the X-ray tube directed horizontally. So for example, this is your X-ray table. This is your patient, nakahigda, nakasupine sa ato ang radiographic table. And then this is your X-ray tube directed horizontally. So naadri dapit yung IR or the cassette niya. So that means that is a decubitus nga positioning. Okay, so again, every time we refer to the decubitus positioning, horizontal ang ato ang X-ray beam. Okay, so in this position, left lateral decubitus, that means this is the left side of the patient. This is the right side of the patient. Okay, so that means, for example, this is the X-ray tube, this is the table, this is the patient nga naka-lateral recumbent, na naka-flex to gayang knee. Then, iyahang hand is directed towards the upper portion na nakatakilid sa patient. That means the left side of the body is placed in contact with the radiographic table. So the purpose for this positioning is to demonstrate almost similar with the upright na position, air fluid level. Okay, so what do you mean by air fluid level, diba? If you have a water bottle, example, this is a water bottle, and then the water bottle is only filled halfway with water, diba? So we can demonstrate the air fluid level by this example, in which half of the bottle is filled with water while half of the bottle is filled with air. So similar sa ato ang gastrointestinal tract, in which, remember, the GI tract is just a hollow organ. Diba? It's just a hollow organ which can be filled with water, it can be filled with air, it can be filled with solid materials. So similar to a water bottle, if we position the water bottle, like for example, in an upright position, so we can demonstrate the air fluid level. If we position the bottle in a, like for example, in a left lateral position, we'll also be able to demonstrate air fluid level, diba? The fluid will go down towards this area, and then on the upper portion is the air. So that's why in this radiograph you can see there is a leveling. See, there's a flat portions. So that means that is the air fluid level. Okay? So that means this is filled with air. This is filled with air. This is filled with air, while the bottom part is filled with fluid. Siya. Okay. So these are your intestinal tract filled with air, gassy materials. Okay, and then you also have here, kanisha, this is a free air, no? Abdomen, demonstrating a free air over the dome of the liver. Okay, again, diba, this is the right side, this is the left side. At the left side, you have your stomach. And on the right side of your abdomen, you have the liver. Okay, kanisha nga portion diri, kita maning black kayo. This is the lungs. Okay, that is part of the lung fields, yang base. While the repeat portion, this is actually the shadow of your liver. So there's a free air inside the peritoneal cavity. Diba? Katato na mention ganina, that is pneumoperitoneum. Diba? Pneumoperitoneum. Pneumo for air, and then peritoneum for the peritoneal cavity. Okay? So if the patient, given the situation that the patient, for the acute abdominal series, given that the patient cannot stand up or cannot do an upright positioning, so what to do? So we position the patient in a left lateral decubitus position. Okay, so that is how you modify the position of the patient in order for you to demonstrate a free air in the abdominal cavity, or the pneumoperitoneum. Okay? Okay, so the first pathology in the GI tract, first we start with the esophagus. So we have here the tracheoesophageal fistula and then atresia. Okay, so fistula is related to an abnormal connection. Okay, so again, abnormal. So kung silang duha ka terminology is related to abnormalities. Abnormal connection. While an atresia is an abnormal closure. Okay, so that means nag-close na siya, or the absence of an opening. Okay, so we have here the different types kani mga images dari from A to letter E. This is the descriptions nila. We have the congenital tracheoesophageal fistula and then esophageal nga atresias. Okay, so when we talk about EA, kani siya EA, that would refer to esophageal atresia. Esophageal, kata na to atresia. Okay, so when we talk about TEF, this is the terminology. Tracheoesophageal fistula. Okay. So again, when you talk about atresia, that is the closure of an opening. So diba, in your normal anatomic presentation, for example, delete. If this is the oral cavity of the patient, and then this is the esophagus, diba, supposedly the esophagus is connected to the stomach. Okay, so what na to? This is the stomach of the patient. Na siya. So they are connected. So if there is an esophageal atresia, that means there is an abnormal closure of the esophagus. So in these examples, there are atresias. Okay, natay esophageal nga atresia. So that's why you have this image here. This is the stomach of the patient. And then as you can see the stomach of the patient, this is the distal esophagus niya. This is the proximal esophagus. The esophagus is not connected. So kibali naputol, or there is an abnormal closure, diba? That is the atresia. So the proximal and the distal esophagus is not connected. So that means they have an atresia. That means if ever this patient would experience atresia, or if this patient is delivered, okay, these pathologies will be demonstrated sa newborn man. If this patient is delivered with a esophageal or with an esophageal atresia, so that means the patient would not be able to deliver the food or deliver the milk. Diba? It's the milk that will be fed first to the babies. So that means the baby would not be able to deliver the milk towards the stomach. So that's why, as you can see in this image, the stomach is constricted, diba? Nag-constrict. Diba? The stomach is a hollow organ. If puno siya pagkaon, then it will inflate. If, diba, mag-balloon. If ever walay sulod na pagkaon, then the stomach can be deflated. Okay. So again, this is the esophagus of the patient that is not connected sa proximal and then sa distal portions nila. So what will happen if the patient or if the baby would drink milk, and the baby will be allowed to drink milk, the milk will just be collected in this area. Okay, so magburot na siya ng distal portion diha. But then the milk would not be able to enter the distal portion of the stomach, the esophagus, and then enter the stomach for processing. So that means no nutrients will be delivered to the rest of the body ni baby. So that means the milk will not be processed also. So, of course, if ever the baby would be diagnosed with this type of pathology, then immediate surgical reconstruction will be needed. So that means operahan gidaritso ang bata. Okay? So, again, this is kanisha an isolated EA. So, what do you mean by isolated EA? That means there is no TEF, there is no fistula, there is no abnormal connection. So, it's only an EA. It's only an esophageal atresia. That's why it is isolated. So, that means the proximal esophagus is not connected with the distal esophagus. Okay, so next we have the letter B. Letter B is EA with proximal TEF. This is esophageal atresia with proximal tracheoesophageal fistula. Again, fistula that is related to abnormal connection. Okay. So we have here the proximal esophagus. This is the distal esophagus. And again, diba, the function of your esophagus is mainly for the passage of food. Okay, for the food that we eat. And then the main function of the trachea is for the passage of air. So dapat dili sila mag-mix. But if we have a fistula, if there is an abnormal connection, especially in this, we start first with the proximal TF. So it is termed as a proximal TF because it is the proximal esophagus that is connected to the trachea. So what will happen to the patient if the patient has a esophageal atresia and at the same time proximal tracheoesophageal fistula? So if the baby would drink milk, the milk will just flow towards the distal portion, the esophagus. And like a balloon, the distal esophagus will expand. Okay? Up to, of course, na siya limitation. Okay? If sobra ra po ang expansion, the distal esophagus may burst. So, in order for the distal esophagus not to be damaged and not to burst, some of the milk materials will be projected back sa mouth ni patient. That means musuka si patient. And then some of the milk na nainom ni patient will be delivered towards the bronchial system. That means towards the respiratory system. So what will happen if the patient, or if the milk that was ingested by the patient will be delivered towards the bronchial system, it will enter dire sa yahan, for example, na dire ang connection. So it will enter towards the right and left main bronchus. That means the milk of the milk that was ingested by the patient will enter the lung fields ni baby. Okay, so what will happen if ever mo enter ang milk towards the bronchial system or towards the lung fields? Of course, it can block off the airways ni patient, ni baby, di ba? Kaya just imagine you have very small nga mga bronchioles, you have also very small nga mga alveoli. So if those alveoli will be filled with milk, just imagine murag mga balloon, similar hapon sa balloon, di ba nga, pwede sila mangbuto. Okay, so, or if for example, dili sila mabuto but they are filled with air, so air cannot pass through the fluid material. So that means maglisod o ginhawa ang patient. Maglisod o ginhawa ang baby. So what to do? So dapat ilagid nang i-extract tong milk and dapat na agi surgical intervention. Bakit? Para putlon na siya diha ang abnormal connection and they have to connect the proximal esophagus with the distal esophagus. Okay, para tuloy-tuloy ang flow sa imong milk from proximal to the distal and then towards the stomach ni patient. Okay. So next we have letter C. Letter C is the esophageal atresia. Yan siya, esophageal atresia with distal tracheoesophageal TF. So kanyang proximal and distal would refer to the proximal and distal esophagus. So you have the proximal esophagus, the distal esophagus. Ganina sa letter B, it is the proximal esophagus that is connected to the trachea. This time, it is the distal esophagus that is connected to the trachea. Okay, so as you can see, the stomach in letter B is deflated. Marag balloon na deflate. While in letter C, naka-inflate na siya, napuno na siya hangin. So the reason for this is, diba, this is your trachea. Again, the main function of the trachea is passage of air. So that means if air would enter the trachea, some of those air will enter diri sa ihang main bronchus to be delivered towards the lungs of the patient, while some of the air is mosulod sa stomach ni patient. That's why it is inflated. So kung x-rayhan nato ni si patient karon, the stomach is filled with air or iyang appearance sa radiograph is black. Okay? Na siya. So still, the patient would not be able to process the milk. Kaya dili gyapon na mosulod sa stomach ang milk ni patient. Kaya nga naman, the milk again would pass through the proximal esophagus man. Tapos the proximal and distal esophagus is not connected. Okay? So that means, dili gyapon maka-flow ang milk. And then we have letter D. Letter D is esophageal atresia. And that means the proximal and distal esophagus is not connected. But they are connected, both of them with dual TEF, both of them is connected to the trachea. Okay? So, dili directly connected si proximal o si distal esophagus. Connected sila dito, silang duha, dito kan trachea. Anak, kibali, anak. Okay? So, that means, if ever the patient would inhale air, so some of those air would enter the stomach. And also, if the patient would swallow milk, then the milk would enter po dire sa iyang bronchial system. So, maglisod gyapon ginhawa ang pasyente ana. So, delikado pa gyapon ni siyang stage. Okay, and then the last one is we have the H-type TEF. H-type nga tracheoesophageal fistula, but then there is no EA. Okay, so that means wala na putol ang imuhang esophagus, pero ang imong esophagus is connected dito sa imong trachea. That means naay buslot ang imong esophagus, napoy buslot imong trachea tapos nag-connect silang duha. So what will happen is pwede silang mag-mix. Air from the trachea can enter the esophagus and towards the stomach. And also, milk, delikado ang isa if milk would enter the bronchial system because that would result to the patient having difficulty of breathing because of the fluid content. Okay? So, those are the congenital, diba? That's why akong ga-mention ganina is baby because this will be demonstrated during the early niyang stages. Kani sila, ma-demonstrate ni sila, and also this one letter D, ma-demonstrate gin ni sila during the first few days sa baby. Kaya for example kani, diba, dili makatulon og gatas ang patient. What happened? What do you think is the reason? Kani siya, dili ihapon katulon, galisod ginhawa si patient, gasigirag the baby, gasigirag suka si baby every time, for example, 1 ml ilang gihatag, tapos most of the 1 ml would just be regurgitated back to the mouth of the patient. So that means there's a problem with the pathway of the food. There's a problem with the pathway of the milk. Or if the patient is having difficulty of breathing, then that means there's a problem with the bronchial system of the patient. So, right after, just after a few hours na na-deliver na ang baby, if ever na ay ma-demonstrate nga na ay difficulty of swallowing, difficulty of breathing, then the baby will be subjected to x-rays. Okay? So, x-rayhan gina sila in order to demonstrate any problems. Okay, so other than having congenital yung mga problems sa kaning fistula and atresia, we also have an acquired tracheoesophageal fistula. So, we cannot have an acquired atresia. Kaya siya kay, kung naman na siya, closure naman na siya. And then, pinaka-common is acquired tracheoesophageal fistula. For example, na kay malignancy, for example, na kay cancer. So, because of the cancer, diba, the cancer is an invasive nga process. We have invasive nga mga cancers. So, buta na to, you have a cancer that is invasive in nature. So, if the cancer is located in your trachea or the esophagus, if the cancer is located in your esophagus, that could create a hole in this area. And then, pwede na niya i-connect dito sa imuhang esophagus, which would create an abnormal tracheoesophageal fistula. And then, same po sad with the infectious nga mga processes. If ever na ay infection dere sa imuhang, for example, kani mga hollow organs mo na sila. Okay, so the fistula is not just limited sa ato ang trachea and then the esophagus. Other fistulas can also occur anywhere sa ato ang body kung na mga hollow organs. For example, the rectum and then the vagina, diba? Those are hollow organs. The rectum and then the urinary bladder, the rectum and then the urethra. Your large intestine and then the small intestine can also create fistula. Your stomach and then your small intestine can also create a fistula. Okay, so pwede na sila mag-connect, mga abnormal na mga connections. Okay, and then last is trauma. If ever na ay traumatic injury to the patient, now for example in these organs na to, we have the esophagus and the trachea. If ever na ay trauma or injury sa iyahang thoracic cavity, so maybe it could result to the formation of an abnormal nga fistula or abnormal connection between hollow structures. Okay, so an example radiograph, we have the lateral neck of the kanisya. As you can see, diba, the bone structures of the patient, bantay mo nila, the bone structures of the patient is still not very dense, no? Dili pa kay siya nga naka-dense, tapos dili pa itong dili pa tong mga normal structures bitaw nga makita yun nato nga muna siya ang cervical vertebrae, muna siya ang thoracic vertebrae. Diba, mura pa sila mga tablet, magagmay pa kayo. Okay, so this is a newborn baby, kani siya. So kaning puti dere, bantay mo ni, kaning puti dere, this is a catheter that is inserted to the mouth of the patient and then injected with barium sulfate. Siya. So it can be injected with a barium sulfate or an iodinated contrast material. Okay? So from this catheter, gisulod sa mouth ni baby, gipaadto dito rapid sa iyang pharynx, and then gi-inject ang contrast material. So the function of the contrast material sa ato ang field is to demonstrate soft tissue structures. Okay, without contrast material, we cannot clearly demonstrate soft tissue structures. Okay, so this is the pharynx, diba? This is the oral cavity of the patient. This is already part of the pharynx of the patient. The esophagus niya, and then as you can see, diba, putol ang iyang esophagus. Supposedly, if this is a normal baby, normal ang iyang anatomic nga presentation, so dapat the contrast material should flow towards the distal esophagus, and then the stomach of the patient should be demonstrated. Pero since naaman siya naputol ang iyang esophagus, so that means this is, and then also we cannot demonstrate the trachea. So that means this is letter A, diba? The isolated EA. Okay, isolated esophageal atresia. Okay, so that means the opening of the esophagus towards the distal portion is cut, no? Naputol. So that means the proximal and then the distal esophagus is not connected. Okay, and in this image, sa pikas nga side, kaning kita mo ning black na portion. Again, kung black, di ba, radiolucent ang tawag ana. And then if black po siya or radiolucent ang appearance, that means it is filled with air. Okay, so that means this is the trachea of the patient filled with air. And then it's not just the lungs that has been demonstrated, but also the stomach of the patient is also demonstrated filled with a lot of air. So supposedly, if this is a normal na baby, then not so much air would be in the stomach. So lateral view of the chest on a 1-day-old, diba? 1-day-old premature infant demonstrates distension of the distal esophagus. Kani siya, kabantay mo medyo gaburot the repeat nga portion. Medyo much wider siya compared the repeat nga area. So this is the distal esophagus filled with air and discontinuity with the trachea. So marked with gastric distension is also present. Appearance is consistent with esophageal atresia and tracheoesophageal fistula. So if we refer this back to the images na to ganina, that is letter C. No? The proximal and the distal nimo nga esophagus is not connected, but your distal esophagus is connected to the trachea. Diba? That means naa siya esophageal atresia with distal tracheoesophageal fistula. Okay, so that is why, diba katong na-mention ganina, that is why air is allowed to enter the stomach. Or that is why a lot of air entered the stomach. Okay, next we also have a demonstration here of an esophageal respiratory fistula o similar gihapon ato ganina katong tracheoesophageal nga fistula. Okay, so kaning mga puti kayo nga parts diri, this is actually filled with contrast material sila. So communication between the esophagus kani siya, this is the main niya nga esophagus and the bronchial tree. So as you can see, di ba, na ay palateral nga mga portions. So that is the bronchial tree niya, seen as complication of the esophageal carcinoma. So that means, di ba katong isa sa mga acquired niya nga tracheoesophageal fistula, if ever na ay malignancy si patient. So na ay cancer si patient, and because of that cancer formation, nag-invade ang imong cancer towards the other organs, and it created an abnormal connection, abnormal fistula. So the connection is between the esophagus and then the bronchial system or the bronchus of the patient. So again, kanang mga puti ito kayong portion, those are filled with contrast material. So dili kay siya kuan, diba, dili siya very detailed nga radiograph. That is because of the cancer of the patient, okay, because of the invasive nature of the cancer. And then we also have acquired tracheoesophageal fistula. 23-year-old female aspirated her dentures. That means ang denture ni patient ay ang marpil ihang natulon, tapos causing an erosion through the esophagus. So diba, na kibali na buslot ang esophagus ni patient because of the dentures, because ihang mga marpil. And then because of that buslot kibali, the diba, when your body experience trauma, it will try to repair itself. Diba, for example, kani siya diripit nga portion na buslot tungod sa tungod sa marpil. This area has a hole dire. So once the esophagus will repair itself, since dikit na kay sila with the trachea, possibility is some of the soft tissue structures will be connected towards the trachea, and maybe mabuslot pod sad si trachea. That's why it can create an abnormal connection. Okay, so as you can see, diba, this is the kani ang yahang esophagus, the repeat nga portion, kani connected towards the stomach, and then this is the trachea din ni patient, baga na demonstrate filled with contrast material. So this is an iodinated contrast material ang gamiton if ever, diba, if ever na ay possibility nga na ay perforation ang gastrointestinal tract ni patient, so we cannot use barium sulfate, we will use iodinated contrast material. Okay, so that is why, diba, your barium flowed towards, no? Padulong siya dire sa imong trachea. Okay, so that is an abnormal connection. Okay, so we also have here a marked distension of the stomach and duodenal bulb with bowel gas distal to the duodenum. Visualization, the classic double bubble sign indicates duodenal atresia. Okay, so for the whole of the GI tract, anywhere can actually experience atresia. So that means abnormal closure. So for example, diba, from the esophagus, food will flow down towards the stomach, from the stomach towards the duodenum. So in this portion, in this radiograph, banada kuno siya duodenal atresia. That means the duodenal niya or the duodenum niya is walay buslot. Okay, so similar atong sa diba, sa esophagus, that the proximal esophagus and the distal esophagus is not connected. So this time is the proximal duodenum and then the distal duodenum that is not connected. That is why, diba, when you swallow food, that means the baby will not be able to pass the food towards the duodenum. So that means dili po na niya ma-digest og ayo. And then if ever air will be swallowed by the patient, the air will just be collected in the stomach of the patient. So that's why we have the double bubble sign. This is your stomach filled with air, and then this is the proximal nimo nga duodenum that is also filled with air. So that means diri rataman ang intestinal tract ni patient. So naa siya ileum, naa siya jejunum, naa siya large intestine, but then putol ang ilang connection. Okay, so that's the problem with atresia. Okay, so also the double bubble sign, this is the AP nga radiograph, and then this is the lateral nga radiograph. Okay, so next, almost similar lang gihapon siya nga pathology, imperforate anus or anal agenesis, in which absent gihapon ang absent ang iyahang opening, diba? There is an abnormal closure of the opening. Okay, so imperforate anus or anal agenesis is a congenital disorder in which the anal opening to the exterior is absent. So that means dili makalibang si patient. And sometimes, if ever there is an imperforate anus or there is anal agenesis, fistula can sometimes occur. Okay, so fistula again, diba, this is the abnormal connection. So abnormal connection can occur between the colon and the perineum or the urethra in boys. And then if female po siya, it's between the colon and then the vagina. Okay? So demonstrated with or can be demonstrated with a cross-table lateral rectum projection with the patient lying in prone or by performing a fistulogram, or basically that is a radiographic examination of the abnormal mga connections. Or if baby pa ang patient, then we can do an invertogram. The invertogram. It is corrected surgically shortly after birth if ever a baby pa ang patient and may require a temporary colostomy. Okay, so these are examples of imperforate anus or the anal agenesis. Okay, so we have here congenital anal stenosis. So not it's not that there is no anal opening, it's not anal agenesis, it's not imperforate anus, but there is a stenosis. So mas similar lang gihapon nilang conditions in which because of the stenotic process, because of the narrowing of the opening, so the fecal materials will not be able to exit the anus of the patient. So fecal material would just be collected diri sa iyang colon. So of course, that would create so much discomfort to the patient, then it would require surgical intervention. Okay? The next, we have anal membrane atresia. So again, diba atresia, that is abnormal closure. So we have here the rectum and then we have the anus nga portion in which it is abnormally closed. So diba dapat open unta ni siya. Okay, para kung open na siya, fecal materials will just pass from the rectum towards the anal canal, towards the anus, and then gawas dayon towards the exterior. Okay, so we also have anal agenesis in which the anus is absent. Okay? So, absent na gid siya. So, that means, diba, agenesis, that means wala gid nag-form si anus. And then, another, we have rectal atresia. Naay anus si patient, sa anal canal, pero ang iyang rectum is putol. Okay, so that means the distal rectum and then the proximal rectum is not connected. So, still, dili yapon makapass through ang fecal materials. And then, next, we have rectoperineal fistula. Kani siya. So, the rectoperineal fistula, that means that the opening of the anus is not in the normal niya nga position, but rather in the perineum. Okay, so diba? Supposedly, dari unta ang opening. Pero, na-transfer siya towards the anterior portion niya, no, na, kuhan siya, nabalhin siya. So, that is the rectoperineal fistula. So, that means the opening niya is tuwa sa iyang perineal nga portion. Okay? Sa iyang perineal nga region. And then, another is the rectovaginal fistula itong ganina na-mention, in which there is no anus ni patient, but then the opening or the exit of the fecal material is through the vaginal canal. Diba, this is the vagina, yan siya, and then this is the colon. So if ever you have fecal materials here in your colon, in your rectum, the fecal material will pass through to the vaginal canal, and then the vaginal canal or this fecal material will exit the patient through the vaginal canal. Okay, so just imagine sa iyang vagina mo gawas ang iyang fecal material. And then for the boys, di ba ito na-mention ganina, you have connection between your rectum and then your urethra. Sometimes the rectum and then the bladder. So they can also be connected, or the colon and then the bladder. So if ever na ay abnormal connection between the rectum or the colon and then the bladder, so some of the fecal material will exit through the sa iyang urethra. Okay, so this is an invertogram. So how to perform this? So ang patient ani, that's literally how the patient is positioned ha. Nakabaligin na siya, that's why it is termed as an invertogram because the patient is inverted. Okay, so sabay terminology ana. So kaya mo rin imong gibitay si pasyente nga ang iyang head is directed downward and then the anus niya or the abdominal cavity is directed upward. So iyang feet is nasa taas, iyang kamot is na diri sa ubos. So if you have a rad tech diri or yahalo kaning mama, so it's the mother or the family members that will hold the baby. Okay, wira niyang tiil, wira niyang ulo, yung portion, in order to hold the baby in an inverted position. Okay, so what's the purpose for an invertogram? The purpose niyan is to demonstrate the extent of the rectum, or the extent of the colon. So diba similar gyapon tong ganina nga naatay air fluid level. Okay? So kani siya how to perform an invertogram. First, we need to mark the anus of the patient. Like for example, diba in this image, these images. Supposedly the opening is dari dapit nga area. So when we image patients for an invertogram, so diri ta magbutang marker. We can put a lead marker in this area and then have the patient position in the inverted nga position, can you see in order for the air to in the intestines nga they will be directed towards the upper portion. So the most upper portion niya dayon dire if we invert the patient would be the rectum. So the physicians would know how much would be the difference or the distance between the opening, the suggested opening niya, and then the terminal portion of the colon or the rectum. Para pag opera nila, dali ra kay kabalo naman sila unsa kataas ang ilang kailangan i-pull ang imuhang kuan, ang imuhang intestinal tract, or maybe they can adjust it with different materials. Okay. So, spot image demonstrating imperforate anus of a pedia patient. So, okay, kabantay mo. The pelvis ni patient is not connected. Yung murag putol, murag na fracture. That is because wala pa na siya nag-ossify og ayo. That means this portion ni patient diri is kanang cartilage pa siya. So, it is normal for children ngayong ana og itsura. Okay? So, basig makaingon mo nga naay fracture ang kuan ang bone structures ni patient no kay dili connected. This is the femoral niya nga body, tapos mo niya ang femoral head. Nagbulag sila. Okay? So this is spot image demonstrating imperforate anus of a pedia patient. Okay, so you have here the distal portion niya, and then kani siya is pasakan na ni siya sa rectum towards iyahang kani siya is the sigmoid, and then pasakan na siya towards the descending colon. Okay? So contrast field ni mga large intestine, if ever magod imperforate anus, pwede nila bangagan ang abdomen ni patient, and then they can have the colon of the patient be exposed towards the external environment, and then magbutang din sila colostomy bag. So if ever na colostomy bag ang patient, then dito rin mo deliver ang mga fecal materials. And if ever the intestine is projected outward, so they can also use that intestinal lining nga dito sila ma-inject og contrast material.